Nearly half of the adult population here in the U.S. now has high blood pressure. The American Heart Association announced new guidelines yesterday, lowering the threshold to include 30 million more Americans. But get this, before these new guidelines, only half of the people with high blood pressure here in the States had it under control. So joining us now is Shauna Nesbitt, a cardiologist at Parkland Health. Thank you so much for joining us, doctor. Really appreciate it. Let's start off by reviewing what's considered normal blood pressure, what was high under the old guidelines, and now what's high under these new ones. Okay.
So high blood pressure, old guidelines, above 140/90, and that is the systolic over the diastolic. What we have always called perfect blood pressure or optimal was 120/80.
Yes.
That continues to be optimal, 120/80. The new guidelines, the hypertension is 130/80. So we have dropped the systolic and the diastolic by 10 millimeters on both accounts.
And I understand we've even gotten rid of pre-hypertension, right?
Rid of it, absolutely.
With these new guidelines.
Correct.
So with this change now, at least 2% of Americans need to see their doctors right away. So let's talk about who needs to make sure they schedule an appointment to meet with their physicians now that these new guidelines are in place.
Great question, Alicia. The first group are people who are in the level that we would call critical. So that is above 180/110. Then you need to see your doctor in order to be treated. The second group will be people who are above 140/90, because that group actually goes on medication immediately. The group above 130/80, you need to see your doctor to be followed, because your blood pressure needs to be reassessed. And the treatment in that group will be lifestyle modification that are more intense than what we have previously recommended in patients. The goal here is that when we said pre-hypertension a few years ago, or actually now 15 or so, it didn't really give people the real impression that this is important, that you need to focus on this and that is progressive. Now it's hypertension. It really is stage 1 hypertension, and in fact data has shown us for several years that people who are in that range of 130/80 and above are progressing to kidney disease, to heart disease, to strokes just as quickly as those people who are above 140/90.
Which is why it's so important to get it down. So before we turn to medication, what are some things people can do to try and keep their blood pressure low? Maybe diet and maybe also activities too.
Right. So exercise is the first. And in that exercise, we recommend that you do aerobic types of exercise. So walking, running, swimming, biking, those kinds of things. The second part of it is diet, and it is keeping your weight down to a normal ideal weight. But the other part of it is really salt. And salt is a real issue, particularly in Dallas, where we like a lot of salty foods.
Sure do.
The diet's pretty high. But if you can get your sodium intake to be less than 2,000, and in fact even less than that would be 1,500 per day, which really will change the way food tastes to you, no doubt. But it's important to do that because you actually may change your blood pressure to a large extent just with reducing your sodium.
Just that simple.
Absolutely.
Doctor, thank you so much for joining us this afternoon and sharing some really good information with us. Appreciate it.